Victoria City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
We didn't find out about this, we weren't informed. There's been some technical or human glitch. Fortunately, Shorty, comes to breakfast here very early, so at 7 in the morning, he lets slip that he's actually in the meeting supposedly here in the executive tower. At first I had to check he wasn't joking. And then sent an emergency message to Tanya. Oh yes. My God, it's been moved. But
it's okay, it's all right.
Tanya's always cool. She's like cool hand Tanya. She's always on top of everything.
Thank you.
And today, do you know what special day it is today? No, you.
Any presents you bring to me?
Yeah, where's the present? If you knew that, where's the present?
Later, okay.
Even more exciting.
All right, thank you. Oh, okay, after this.
Even more exciting than Tanya's birthday, it is...
World Arthritis Day.
World Arthritis Day. Yes. And it's a huge rate of infection around the world. Like there's 2 million people in... it's the fourth biggest cause of disability in the world is arthritis, yes. Some form of arthritis.
Yes, but to me it's like a non-medical personnel are feeling confused about the arthritis and osteoarthritis.
Yeah, so one of the big confusions is, what is osteoarthritis, yes. And what is arthritis, and how they are very different. Now, the most important thing I say all day is switch your phones off or to vibrate. The vibrations you might get excited by, but they won't help your arthritis, okay? Unless there's some new app coming out, Dr. Pratchard.
Yes, so let me introduce a doctor right now. So please welcome Dr. Patya Jalajit Vilai, Orthopedics and Sport Medicine, and Dr. Nantalat Wongwara Apon, rheumatologist at the medicine unit. Please welcome our doctors.
So a bit of a very different format for us today. As always, please do not surf the web during the talk. Multitasking is a myth. It shows disrespect for whoever the speaker is and me.
Can I please have one more microphone? Someone stole my microphone around. Oh, you? Okay, all right.
No, Les stole it.
Okay, please have a seat. Yes, to be honest, I'm a little bit excited because I have never been doing this at the club. I'm normally doing this in the hospital, as an event hospital. So before we are going to start the talk, like Dr. Lind already announced that today is a special day, it's World Arthritis Day. We would like to give you medical information about the difference between inflammatory arthritis and osteoarthritis. We're familiar about the disease and symptoms like closely when you get pain on your joint, on your finger, your knee, wherever. So today we will get more information, and please do not forget at the last section there will be the lucky draw. If you did not have your number, let's get the number. You will be surprised at what we are giving today. So before we are going to start the first question, let's Dr. Pratya explain about what arthritis stands for.
สวัสดีครับ Hello everybody. Okay. A little bit Greek Roman words from arthritis. Sorry. Oh, want me to stand up? Oh.
Okay, all right.
Okay.
Yes.
Okay.
Oh, we are standing up?
Stand up when you talk.
Okay, sure.
So like a squatting, it's good exercise, right?
It's good for the joints,
like exercise.
Right?
Good. That's good.
Right. Arthritis is come from Greek or Latin word. Arthritis is from arthron, is meaning from joint, and itis is meaning inflammation. So combined, arthritis is mean joint inflammation. It's just the not a specific word. It just means your joint have inflammation. It doesn't mean that it have the rheumatoid, not inflammatory, not inflammatory, just arthritis. Okay, joint inflammation.
It's very short.
I'm not going to stand up because people don't want to see me. Why should patients with joint pain see a doctor?
Okay, good morning, everyone. First of all, thank you you all for coming here today. So the joint pain is a very common complaint in the general population. The patient with the joint pain is an effect to the all aspect of the quality of life. It's an effect to your job, it's an effect to your doing activity, it's if you run for a while, it's an effect to your stress and emotion. So it's an effect quality of life. And the cause of the joint pain is sometimes it's difficult to identify because of wide spectrum of the differential diagnosis. So this is the reason when you have a joint pain and try by yourself, but it doesn't improve, please see the doctor for find out cause of it and treat it adequately.
Mm-hmm. So can you please give us some example about the joint pain, as you show us like the soft tissue problems, the joint diseases and others? Can you please tell us something
Sure.
like that?
The patient with the joint pain is not only the joint problem. It maybe come from the surrounding soft tissue around the joint, like ligament, tendon, bursa, muscle, and bone. So, but sometimes you have no problem about the joint or the soft tissue surrounding the joint, but it's the refer from the internal organ. Like when you have a kidney problem, you present as a back pain, or sometimes the patient has an angina that pain at the shoulder, radiate to the arm and radiate to the neck, or sometimes patient has a nerve problem like a carpal tunnel syndrome, present at the hand pain. So it's many cause of the joint pain. So you should specify what is it and deep in what cause of it.
So as a picture, you see, Dr. Lin, there are different picture of the symptoms, right, doctor? The different.
Oh, sure. This meeting we focus on the joint problem and the surrounding soft tissue around the joint problem. We can differentiate between two conditions by your symptom. The patient with the soft tissue problem like a ligament, tendon, or bursa, you can specify the area that you have maximum pain. And the sign of inflammation is only localized in the one particular pain. It's not around the joint. And when you move, it's a limit in some direction, not all direction. Opposite with the joint problem. You can tell me about the pain in the joint, around the joint. It's around the joint boundary, and the sign of inflammation is around the joint. So you can see the difference. I can give you the example. Picture number 1. This is a soft tissue problem. The patient has pain only one side of the wrist, and is aggravated in some direction. This is a tendinitis of the wrist. It's called the gawang. It's a very common. It's come from repetitive use, overuse. The picture number 2, when you play tennis a lot or do the hard working, you can specify the area that the maximum pain in the one side of the elbow is a tennis elbow. You can see the picture number 3, the right Achilles, you can see the swelling compared with the left side. This is an inflammation at the side Achilles tendon attached to the bone.
So this is like example for inflammation. You think?
This is
incrementally.
This is example for the soft tissue problem. Soft tissue problem is maybe you can see the inflammation, swelling is cannot move, cannot touch, is a limit length of motion, but it may be come from many causes.
So how about the joint disease? To the next, like number 7 or number 10?
Okay, you can see this is so different. Picture number 7 and number 8, you can see the swelling is entire the joint boundary is a swelling. The number 7 is arthritis at the knee. Number 8 is a common gout attack. I think there's someone in this room had experience about that. And And then number 9, number 10 is if you let the inflammation or the joint problem for a while, is make you have a joint deformity. Like number 9 is a rheumatoid hand, and the number 10 is osteoarthritis hand. Knee.
Knee. Okay, thank you, doctor. So for the next page, that will show up the difference about the inflammatory, doctor said, and osteoarthritis. So, yes.
So the joint disease, joint disease can be divided into main categories. The first, you have to you can differentiate into main category. The first, on the right, this is an inflammatory joint disease, and the left side is a non-inflammatory joint disease. Let me explain you about the non-inflammatory joint disease first. Non-inflammatory joint disease prototype is osteoarthritis. Is a degenerative change. Is a mechanical problem. But the inflammatory joint disease is maybe come from the many causes. First is come from the systemic autoimmune disease like rheumatoid arthritis, psoriatic arthritis, or it maybe come from the crystal gout, pseudo gout, or it maybe come from the infection, bacteria, viruses, tuberculosis, or the I can give you the example. So the osteoarthritis, you can see, you can differentiate between two conditions by yourself. You can observe your symptom. The pain from the osteoarthritis or non-inflammatory joint disease, pain get worse by motion and improve with rest.
Yes.
That opposite with the pain from the inflammatory joint disease is a pain get worse after rest and improve by the motion. You can observe by yourself. And some patient has an inflammatory joint disease typical after wake up. It's so stiffness and difficult to move. It's like a thin man, but it's improve when you move or do something, or take a shower with warm water. It helps a lot. But the duration period after wake up is last long more than 30 minutes or maybe many hours. But the opposite with the osteoarthritis, pain after wake up just a minute, not last long the 30 minutes. And you can see the sign of inflammation. You can see it's so different. Inflammation from the inflammatory joint disease is so obviously. But the sign of inflammation of osteoarthritis is, you can see, is just the bone deformity and the bony swelling.
That's very good explanation. So let's go to the detail about the osteoarthritis by Dr. Plesya.
Can I just say something? I've already learnt something today. Who has learnt something today already? Right? Don't be frightened to put your hand up, right? And of course, the video will be on YouTube on the PCEC channel, so you'll be able to rewatch it and get any details that you missed, okay?
Okay, so you can see the difference between the picture on the right and on the left. But the challenging is not only it can separate left and right. Sometimes it's together, such as when you're getting older, you have osteoarthritis of your both knee. But someday you eat some chicken, you drink some alcohol, and then your gout come to join your osteoarthritis. So sometimes it's one, it's two, but sometimes it's combined together. So life is always difficult, right?
Before we are going to the approach to arthritis, doctor, I heard about the joint pain and the difference between the arthritis and osteoarthritis is about wake up in the morning. The symptom and the pain is different between two diseases, or what exactly mean? You mentioned about wake up in the morning. If you have like arthritis, you're feeling this. And if you have like osteoarthritis, when you wake up in the morning, you will feeling the different things.
This is the symptom like duration of the morning stiffness can help us because the inflammatory joint disease like rheumatoid arthritis, the patient need time to feel better. After wake up is more than 30 minutes. Usually the typical case, the patient will tell me is very tired and fatigued and joint stiffness at the whole body. But he try to move and take a shower with warm water and do the daily activity. It's more than a few hours is better. So the duration is a point. If the patient has an osteoarthritis, the stiff is not the last longer hour. It's just the need time. You need time to get up. It's maybe few minutes. Yes. So I ask you one thing more. So the patient with inflammatory joint problem, some is a systemic inflammation. Some patient has experience about the fever, weight loss, or the fatigue, tired. But it's the osteoarthritis. Is the problem is only the joint. You have no any symptom like that.
Basically, with the osteoarthritis, it's basically confined to the joint, mainly the pain.
Yes, but the chronic inflammatory joint is a systemic condition.
My turn? All right. So, what can the doctor do about the joint pain, right?
Sure, the diagnosis, the first step and crucial step is the clinical evaluation. Is the diagnosis of the joint disease is rely on mainly your sign and symptom. It can give us around 80% of the differential diagnosis. The laboratory test or X-ray can give support us and confirm and exclude other cause or evaluate your baseline condition. Because the laboratory test that you, I think maybe you know about that before, right? Inflammatory marker, rheumatoid factor is non-specific. It can be positive in other conditions like cancer, infection, or even normal person. You have to get to the clinical evaluation first, because if you use only laboratory test, it may be misleading.
So this is mean that when you have a feeling about pain on your joint, wherever like knee or fingers or on your joint, you have to go to see the doctor to clarify and get the investigation. The investigation you mentioned is not only the blood test or urine test, is inclusive of like X-ray imaging to see exactly what happened to you. So, which we can see on the skin, like they are the approach from the medical history, physical examination, imaging, and then the laboratories. This is the test that you are providing to our patient, is correct?
Depend on my differential and diagnosis, and depend on sign and symptom that we get from my patient.
Mm-hmm. And how about the osteoarthritis? I believe that you guys, when you have like pain on the joint, you are not going to the hospital and ask to see like, okay, I want to see rheumatologist or I want to see orthopedist. But sometimes the patient are starting the journey at the orthopedic center. So you have some kind of this patient and asking for the test from you directly, Dr. Patya?
Don't worry to come to see me or to see Dr. Nantarat. We can handle that. You come with the pain. You don't know exactly which problem you have. So it's our job to find out that what kind of problem you have. Many people come to see me, even they have the rheumatoid arthritis. Like the hand rheumatoid, it's not so difficult to diagnose it. But to make sure, we have to take some blood tests for the rheumatoid. We have to take history examination as well. And then if it's suspect the inflammatory joint disease, I will transfer you to see Dr. Nantarat. So don't worry about that. So basically,
just clarifying, one of your specialities is orthopedics, yes? So can you tell them what orthopedics is?
okay.
Yeah.
Orthopedics. Let's go back to the Greek Latin again. not have to do that. I am the orthopedic specialist. It means we take care of you about bone and joint problems, including surgery. So yeah, and also with when you have the broken bone, when you have you need a new shoulder, you need a new knee, so you can come to see me.
So you cover bones, joints, and muscles as they relate to those as well.
Yes. And Dr. Nantarat, she is rheumatologist. Basically, she is maybe she can maybe she can introduce
Dr.
herself.
Pratya, why don't you explain what are you doing in the hospital instead of explain what Dr. Nantarat doing? So the orthopedist at the orthopedic surgery center. So he's a surgeon. He's the orthopedist who taking care of the bone, muscle, ligament, and like the patient who has trauma, an accident, or pain, they can come and see Dr. Pratya. And he also specializes about the sport medicine. He's taking care of the sport people who playing golf, who playing sport and had got some pain on the joint or sport problem. He also taking care of that kind of patient as well.
Did any of the golfers make it in today? Any of the golfers give up golf to be here today? Because that's a lower back problem is quite common with golfers, yeah. Yeah.
Golf. Yeah, golf. It seems to look simple. It seems to be easy. Just walk and shooting. But it doesn't like that. It's very mechanic. You need to understand a lot about your body. To stroke the golf ball, you need to have the good back. Like the center of rotation, you need to have the good left knee, exactly, and good shoulder as well. So it's like your whole body. Many people have injured from golf. Yeah, so please be aware.
A lot of your patients come from golfers, do they?
Yeah, golf is one of the common one.
Yeah, it's tougher on your body than you think. So.
Yes,
and also, I had a friend, I think he came and saw you, he had tennis elbow and stuff like, tennis shoulder I think he had. Yeah. And I think you ended up prescribing cortisone injection for him, yeah?
The most common elbow problem in golf people is tennis elbow. Exactly. With, okay. See my arm. Or you want to show your golf elbow? Or just itching, right? Okay, so we are going to the golf tennis elbow, right? It's you. Okay. So see my elbow. This is the thumb side, right? If you have pain in the outside of the elbow, we call tennis elbow. The reason we call tennis elbow is come from backhand. When we do the backhand like this, we use that tendon a lot. So it's called tennis elbow. For golf elbow, is in the opposite side. It's here. The golf elbow is come from when you hit the ball this way. So you have pain in this side. It have more strain there. But the reason is the tennis elbow is more problem in golfer because it happens in the left elbow. When you hit the ball, like to twist the wrist at the left elbow, so you develop the tennis elbow at the left when you golfer. Yeah.
What sort of treatment do people get when they come to you? You have a range of options when you treat.
Yes, yeah. But before we are going to the treatment, ladies explained about the investigation in the case of patient see the orthopedist. Yes, doctor.
Yeah, I know you have many questions now in your mind. Not only you, Dr. Ren, but many of you have, and some of you already my patient, and Dr. Nantarat patient as well. So the most basic investigation, easy to do, non-invasive, is X-ray. This picture is X-ray of the knee in the normal knee, young people. So you can see how it looks like this, and compare to the next one. This is the severe osteoarthritis. You can see the joint space is closer. You can see the alignment of the knee is changed. This knee is like a bow knee. Okay, many of you have already bow knee, bow leg, so it's also the sign of osteoarthritis. Sometimes we not only need X-ray. Okay, this one is we call long X-ray. Is the X-ray from your hip to your ankle. This X-ray mainly is want to see your alignment of your knee. How bad is your bowing knee? How bad is your knock knee? And we can calculate measurement and planning for the operation, something like that. No? Some patients also need an MRI scan, especially in sport people or not too severe osteoarthritis, to make sure about your meniscus problem, about your the structure inside the knee, how bad is inside, how we can fix it or not.
Why the patient needs MRI? Why just X-ray is enough?
Back to the X-ray. Basically, you can see the bone, you can see the space, you can see the alignment, but you cannot see the soft tissue inside. You cannot see the cartilage. You cannot see the meniscus. Meniscus is the structure inside the knee, in the shock absorber thing. So in that case, you need to make an MRI scan. And you can see this picture, MRI scan of the knee. This guy went to the machine. This guy went to the machine with his feet. Okay, so for MRI of the knee, it's not too bad for the person who have claustrophobia, because the head is outside. But if you have MRI for the brain, for the shoulder, your head must go inside, so it's a little bit challenge. Kun Tanya asked me about the arrow. What is that? Put pointer. This one. So this is the area of the normal bone in this picture. It looks like in this black color. Okay. Here is more white color here. It means this bone, it has some injury, some contusion, or it's lost some cartilage around here, this surface. This picture also show that the meniscus is a little bit going outside with some tear in this area.
So mean this patient needs a surgery?
To say that patient needs a surgery or not, it's not cannot say by the picture. We have to see the patient individually, that he needs it or not. The picture doesn't mean you need operation. Many people with a bad picture but no symptom.
So maybe they don't need the surgery, you mean?
Yes or no?
Okay, all right. So we are going to talk about the treatment. Let's go to the treatment. So the next one will show the multiple circle about the treatment and recommendation. Yes.
Can I just ask, who here has had an MRI, magnetic resonance imaging? Yeah, I've had one, and I do get claustrophobia, so it was tough. But also I had an MRI. I was lucky enough to receive a voucher for the prostate checking, and that included an MRI. They have excellent MRI at the hospital. Great technicians there, do a really fantastic job.
Okay, if you ask me about the treatment, specific treatment is depend on specific disease, but it's not only the specific treatment that you should get. Because that I mentioned before, the patient with the joint pain has a multiple problem. It's an effect about the sleep, it's an effect about the emotional and stress. So you have to take care all of aspects. And especially the patient has a chronic joint disease like osteoarthritis, your muscle weakness, you have to improve the muscle strengthening exercise and muscle stretching, because it can relieve your pain and improve and preserve your joint function. So the treatment of the joint is not only the joint, but you have to treat in all aspects of your problem. It's like a holistic approach. We need to get the multidisciplinary team to take care of that.
That is very good information that I just heard today. And have you know before, Dr. Lin? Have you heard about this?
Yes. Now, this is very important because these sorts of things, for starters, can affect your sleep, and that's really, really critical because poor sleep will make the inflammation worse. But also, I have spondylosis, and I've got great benefit from a friend of mine who's a yoga expert in giving me particular stretches that have really helped. So, yeah, no, you really want to have a whole, let's face it, looking after your bodies is a multidisciplinary thing, right? It's, so.
Yes, and I seen on the picture, there are the orthopedist is one of the team that you giving the treatment of the patient. So Dr. Pratya, in the case of patient who have seen a rheumatologist and they have been treated by medication, exercise, whatever that Dr. Nantarat mentioned before, if it's not improvement, or not getting any better. So you could help us, right?
Of course. Many times, Dr. Nantarat transfers patient to me. It have many indication to come to see me. Number one, when the patient is not getting better, if the inflammatory arthritis is not better, sometimes she needs the tissue biopsy to make sure that what exactly problem you have in your knee. Number two, or not only the knee, maybe the shoulder, the another joints. Number two, if the patient have infection of the joint and not getting better by antibiotics, sometimes it needs the drainage, the procedure to relieve the pus or the fluid in the joint, so I have to take care as well. And yeah, something else like make some injection, make the procedure that go inside your body. So it's come to see me in that case.
Yes.
So yes, there could be a long rehabilitation, permanent management issue for some people. How does the weights tie in with that? weight training, weight management.
Re-
They've got to manage their own weight because the heavier they get, the more strain they put on joints. What sort of exercises or stretches or stuff does that include? Are they included in the therapy?
The picture, this weight management is more like your body weight management. It's not the weight training. It's more like you to control your body weight. Yeah, As you know, if you have the large body weight, it affect more in your lower extremity joints. Every time you get 1 kilogram more, your knee has 3 to 4 times more load. So in the opposite way, if you lost 1 kilogram, your knee is lost the load 3 to 4 times as well. So it's really affect.
Oh, that is interesting.
Yes. So the next one will be the treatment from you, Dr. Pratya, that you would recommend it to our patients. So let's talk about the treatment that you are recommended to us.
Okay. So right now maybe some of you feel boring, but anyway. So
I can assure you, no one in this room is bored, right? Because these are issues that you might face or do face.
But anyway, I would like to say that this topic today is not easy. So it's like you guys gonna be like a medical student now. So it's I'm glad that you're still here and listen to us. Next slide is gonna be more medical student. Okay. There's many aspect of treatment of the osteoarthritis, from the medication, from physical therapy, from injection, and finally operation. You don't know what is good, what is bad. This year, the American Academy of Orthopedic Surgeon, AAOS. Some of you come from the US, right? Yeah, perfect. This is from your country. So in this AAOS, this year is classified the treatment in the 4-star, which means significantly tell us that it's okay, and 1 star is significantly tell us it's not so help. But the star, it doesn't mean that the treatment is good or bad for you, okay? But it just tell us have the strong evidence. Let's start with the dietary supplement. Many of you take glucosamine, right? Can you show? Okay, 30% of the room. Do you think it's help or not? Yeah, okay, that's good. So the AAOS said it's 2-star. 2-star is mean, yeah, not too bad, but not really help, okay? The topical NSAID.
Sorry, just to clarify that when he was talking about the stars, it was about how much weight of evidence from scientific study there is, right? So obviously if you try something and it helps you, it's 5-star, right? But this is the stars is just about how many and how scientific studies are.
Next one is topical NSAID. NSAID is come from non-steroidal anti-inflammatory drugs. Okay, you may know something about the ibuprofen, the diclofenac, the Celebrex, the Acoxia, something like that. This is the NSAID. Okay, the topical NSAID is mean the NSAID is not take orally. It's just put like a cream or the spray to the joint. So the topical NSAID is okay. It's help 4-star. Okay, have evidence that it can help you. It's simple. It's not much. Not have a lot of complication. The oral NSAID, yeah, 4-star as well. But anyway, the 4-star is not 4-star for every people. Some people have bad kidney, bad liver, so you should avoid this kind of medicine. Oral acetaminophen. Acetaminophen, in Thailand we call paracetamol, we call Tylenol, we call Bacamol from our hospital. Yeah, and some country have different trade name. So oral acetaminophen is 4-star as well. Okay, it can help less complication, but it may not high potential. Okay, it may be used for the beginning of the treatment. For oral narcotic, it's not recommended. So 4-star not recommend is mean don't do that. Only sometimes we need narcotics, such as you have very strong pain, you have the pain from the operation, something like that. You need the narcotics, but it's not for the daily use. Too high complication. For physical therapy, the treatment is something that it lists, the electric stimulation, the shock wave therapy, the laser stuff, mainly is 2-star, same as glucosamine. Okay. Many of the patients love physical therapy, but many of them not like physical therapy. Some people said it's waste of the time. But I would say the therapy is maybe help in some situation, like when you want to rehab after the operation or some certain problem. And for exercise, for training, for weight loss intervention, for education program is around 3 to 4-star. Okay.
So you are talking about like what the treatment is starting from the supplement, medication, physical therapy. It's like step by step, right?
No.
Okay.
Same thing. It's like tailor-made for you. Each people need different thing. That's why we are people. Some people directly need injection. Some people just some medicine, but some of the people also need directly to operation as well. So it depends on the severity, on the problem. Let me speak next to the injection. Yeah, somebody of you in this room love needle. Who love needle? Nobody, right?
Your hand up if you like getting injections. Wow, that's a surprise.
Have any one of you have cortisone injection before? And oh wow, okay. And then how do you feel about the injection? You like it, or you super, right?
I've had a cortisone injection that helped me a lot with a joint thing, yeah.
Okay, let's talk about cortisone. Cortisone basically helps for your pain. It doesn't improve your condition at all. It cannot make your knee getting younger. Okay, it just make your pain less, make your better quality of life temporary. Usually about a couple months. Okay, but anyway, the benefit of the cortisone is it less invasive. Just one needle, outpatient, really quick procedure. So, but should not be too much. Some doctors said it's not more than 3 times per year, but I think it's just only when you need, only necessary. For the hyaluronic acid, this one. Some of you also have this injection as well. Some doctors said it's oil, it's lubricate, it's supplement for the knee. It's help your knee in a different way. It's have good benefit if your knee is only mild to moderate degree. The severe people, this injection is not quite helpful. And the last one is the platelet-rich plasma, the PRP. The PRP is the good thing is from your own blood. We take your blood, about 20 ml, and then make a spinning, and then get the plasma about 5 ml finally. And we take that plasma back to the joint. It's also 2-star. So if the patient come to see me, I would say it's 50-50. Okay, and I did it more in last 4 or 5 years, but now because it's not so helpful, so only some patient.
Yeah, this is about like non-surgical treatment that you normally advise to the patient in different symptoms, different conditions. And if they treat by the non-surgical treatment and it doesn't work, not getting better, how would you recommend them for the next step?
So as I said, it's tailor-made. So I would come back to see how it's going on with your joint. For example, for the knee is the most common osteoarthritis problem in our orthopedic center. The minimally invasive surgery is made suitable for somebody is arthroscopic surgery. It means we put the camera inside your joint and then we make the procedure. The procedure such as to cleaning, to tidy up your cartilage, maybe makes meniscus repair. So it depends what problem exactly you have. Some people have bowed knee, but it's not too bad enough to make the knee replacement. So we can do this procedure called high tibial osteotomy. It means we realign your knee. In this picture, you can see the knee. This is the left knee, okay? The hip is up here, the foot is down here. So the knee is like bow inside. It's like a bow knee. I'm not sure you understand me or not. Bow knee is like. This operation is correct your bow knee, to make the bow knee less. By make this procedure, shape this bone and then finally it's healed like this. So the knee is less bowing, it's more go outside. So this is another way to treat your arthritis. It's also kind of a joint preservative.
So you basically straighten the alignment of the
yes.
upper and lower leg.
Yes. This operation is quite common in Europe. The hospital where I did train in Germany, we do it a lot. The good thing is, you can see it's the same knee joint, but just change the alignment to sharing the load from the bad side to the better one. Yeah. And finally, okay, this is the before and after bow knee and more straightened knee.
So after that surgery, you mentioned the patient is feeling no pain and could walk like normal, or what help that you mentioned about the alignment of the knee surgery?
Okay, let me finish my slide.
Yeah, go ahead.
And anyway, this is the last slide, the end of the road, you know. When you drive your car long time, sometimes your engine is not good anymore. You need the new engine, same thing. Some of you already have the knee replacement or the hip replacement, right? Okay. Replacement is if you're not getting better by anything we have talked before. So this is the last choice. I put this choice at the end, not at the beginning, at the end. The reason is when you have the artificial knee, it's not stay with you permanently. It have the lifespan, usually around 15 years. So if you have the knee replacement too early, it means next 15 years, you may need the revision one, okay? The revision one is more complicated, more difficult. So yeah, try to make this one as late as possible. The challenge is when you make it late, your body have also many medical issues, right? Diabetes, high blood pressure, so it's make a little bit more challenge.
So the best thing is wait till 15 years before you're about to die, before you get the joint replacement. So
If you know that.
as they've just got 15 years to live, want a joint replacement.
Back to your question ครับคุณธัญญา she asked me about the after this operation you're gonna pain free or not. I would say this is a sharing load operation. It shares the load from the bad side of the knee to the better side of the knee. So usually the people have feeling better, but maybe not 100% because the bad knee is still there. Just change the alignment, but it's good enough for your daily life.
So I don't want to have this kind of problem. How could I prevent it?
Maybe I already talked too long. Let my lady doctor.
Okay, the prevent I can give you in the general view, like the important, effective, natural way is the healthy lifestyle modification. It is a beneficial to all joint problem and all the other health problem. The first is a healthy diet. Nowadays, many data show about the anti-inflammatory diet. It's a plant-based food or the green is a composed of green vegetable or the nut seed. Legume has an anti-inflammatory effect and antioxidant, so it's a good. The second, healthy exercise. When you exercise, keep physical activity is the preserve the joint function and keep your joint mobility is good too. The third, happy sleep. Healthy sleep is very important. Number four, the healthy mind. When you have to do the stress management and keep positive attitude and meditation. And finally, healthy relationship. If you have a good relation with other people, your mind is good, everything is good, because it's all connected.
That's very good recommendation. So Dr. Lin, you are in a very good relationship. Make you feel better right now, I can tell, right?
So anybody here want to put their hand up and say they are happy with their relationship with me? Well, one person.
Oh, no one. Oh, yeah, just one.
One
Thank
person,
you,
there you
Anthony. Yeah, so that's very good advice. But the exercise that you mentioned, so Dr. Pratya, you are a sport medicine, right? So you could give us the exercise, for example.
Right now, we are in 2022, right? We not move so much. We sit so long. We have mobile phone. We have computer. So it makes us sitting a lot. To sitting a lot, it make your hip always like this. To make your knee always bending. Okay, to make your back a little bit lumping. So it's kind of to make your joint not in the proper way. So number one, you need to move. Okay, somehow some exercise, some move. With this limited time, I will explain you a little bit about some benefit of some exercise that benefit your joint. Okay, you can do with me if you want. Number one, we do the squatting. Okay, squatting. Dr. Loren, would you please join me? Okay.
I've been waiting my whole life for this moment.
Perfect. Okay, so to make squatting, you don't have to bend your knee too low. Okay, maybe just at the 45 degree or that you not feel pain. Yeah. Okay, let's start step by step. Point your foot to the front. Okay, your foot not outside, not inside, just in parallel. Yeah. Your hand you can do like this lady, or you can just put it on your waist. Oh, perfect. Okay.
Feel free to stand up and join in, you know. Come
Okay.
on, George.
Okay. And then slowly bend your knee. Slow and very slow, like slow motion. Okay. Do not put your knee in front of your toes, okay? So you need to put your buttock behind, like this. Not like this, nah. Not so quite like this. You need to go this way, okay? And stretch your back. See the front, not see the foot, see the front. And then slowly getting up. Okay, very, very slow motion. Can I touch you? Put your back behind. Put your back behind. Yeah, put your back behind. Yeah.
So this is the going to the toilet stretch.
Yeah, but yeah, don't take some laxative now. Okay, you can do like 10 times for 3 sets. Okay, 10 times, and stop a little bit, and 10 times more. Okay. The next one, yeah, this one. It's called. Oh. Okay, next one, just yeah. Sitting and curl your knee up, and then put your ankle up. Okay, 90 degrees. Yeah, this is exactly right. And hold this position about 10 seconds. Okay. And then slowly down. You can do 10 times for the left, 10 times for the right, and left and right, 3 sets as well.
Yes, that's very good example for the exercise. So let's go to the questions that you guys are having question in the mind. I can see on the face. Okay.
George?
Doctor, thank you very much. I think this last exercise or exercises you showed us, the breathing is a very important aspect of what you're doing. How you breathe, how you exhale, how you inhale. Can you explain that?
Very good question for the breathing exercise, for the breathing in this exercise. Normally, I don't explain the patient about this thing, okay? Because it's gonna make the patient too many things to do. So in the clinic, I don't say about the breathing, just normal breathe. But if you want the really breathing focus, so every time your muscle is relaxed. When your muscle is relaxed, you breathe in. But then when you contract your muscle, you breathe out, exhale. Okay. It's like when you push up. When you're going down, you breathe in. When you push up, you breathe out. So when you use the muscle, you breathe in. When you contract the muscle, you breathe out. Yeah. But anyway, first thing, you just do it first. The breathing is more detailed for you. But thank you for the question. Yes, please.
Oh, Doctor, interesting instructions. I've always believed in self-help and exercise. I work out moderately every morning for 20 minutes. Exactly the exercises you're doing, but with a few calisthenics that I use myself. But I'm a firm believer that you have to treat the body inside. And all my life, probably since I was 20, I'm now old. I'm even older than this chap. But I've always taken supplements, particularly cod liver oil, hydraulic acid, and Viagra. No, not Viagra. And I found that over the years, this has benefited my joints tremendously. I've got a bit of osteoporosis in my second and third vertebrae, but that's the type of work I was doing. But generally, I find my joints, the fact that I've looked after them is to my advantage now. And I can benefit by also swimming, another very good exercise. The one thing I want you to explain to me is what causes a frozen joint. I had it once in my shoulder, and for 3 months I couldn't pick anything up. As soon as I touched something, move my arm, Jesus. And eventually a very good old professor consultant decided to inject my joint. And the pain of him pushing a big needle into my joint was absolutely terrible. But they used cortisone then, and after about 4 days, I've never had any trouble since. So injections are useful, but also you need to service the body all the time, all your life. If you don't do that, you don't get the benefit later.
Thank you for your question. So just have a short answer for you. The joint stiffness, or we call frozen joint, the most common one is a frozen shoulder. The reason is the shoulder is like 360-degree move, right? If something is disturb your range of motion. The frozen shoulder can come from without any reason. It just come. Number one, it just come. Okay. It may aggravate by your work that you not move a lot, or it may related to your diabetes, to your thyroid problems. This is like a primary, without any cause. And frozen shoulder can come from another reason that is secondary from something, such as you have broken some bone around the shoulder. When you have broken your rotator cuff, when you some injure, or any something affect it, infection or something, it can affect, it make the frozen shoulder as well. So I appreciate that you have very good discipline of exercise.
Thank you, Doctor. I've got to say that's a very, very good talk, because I happened to have fallen out of a golf cart, and did my knees in a bit, and I've been to your hospital. The hardest thing to do is to find somebody like you, because I go to the orthopedic department. I'm then sent up, because it was busy, sent up to see the gout doctor. She's supposed to be very good at gout, and I had high recommendations of her. It wasn't gout. She sends me to the physio. She says, well, we can do physio. Then after that, you can try that, and if not, injections, and if not, an operation. So we go down the route of the ligaments and everything, having physio on that a few times, and then then we go to the young doctor there who gives me cortisone injections, and we did talk. He's quite a fun guy, I think, but not serious enough perhaps for me, because he does say you can have a new knee. If you have a new knee, you won't have any problems. You'll be able to play golf again. So, however, it is the hardest thing, I think, in your hospital to find the right person for the right thing. And I will be coming to you because I also believe that it might be a good idea if I've had X-rays from your hospital, but I think I need an MRI, because I think it's more to do with the patella, actually. Have you heard of jumper's knees? It's a word for sort of tendonitis or something to do with the patella. But I will make an appointment to see you, because I think you're a very good talk for me personally.
With pleasure.
Okay, thank you. I think any questions? So we are going to. Okay.
Thank you very much. It's a rather large subject you're on at the moment, and a lot of gentlemen here, like myself, are all feeling pains in various areas, and it's all through wear and tear because we're living longer than they say than we should. But never mind that. We are living longer. I'm now 89 and still enjoying life, right? And I think even doctors have to learn, because I, like John, in a way disagree with you in as much as cortisone steroids, because over the years I've had acupunctures, I've had all different things for my knees, right? Now, okay, I used to do cycling, I did running, I did everything in my youth, and I still think I'm very, very fit. But I do have a joint, knee joint, right? And I have found by experimenting with different people that steroids or cortisones, whichever you like, are the real answer for me, because I disagree with you saying it only lasts 2 months. When I've had good injections from a gentleman who used to be a health person, they will last 6 months for me, and I would have a lovely life. Every day, by the way, I walk 1 hour from 6:30 to 7:30 average every day, right? I used to do a lot of swimming, but I can't now because I've had an eye problem, and I've now had my T ducts problem, and I have to get my stents removed. That's why I don't swim anymore, unfortunately. So I think you should be all open to experiment. We all have different problems, you see, and I've found 100% that when I've had a steroid or whatever you call them, injections into my knee, I'm 100% good for 8 months before I need again. And okay, I've gone for acupunctures, I've had 8 or 9 of those in my knees and my shoulder, and yes, they cure them, but it doesn't last, unfortunately. Where a steroid did last. So we have to be a bit more open-minded with respect. And if you can give me injection in my knees, maybe I'll start coming to you, because I have gone to a different person now, because the other person has disappeared from this earth. I don't know where he is now, a different country maybe, I don't know. And I've been to another one, a younger person, and he has given me 1 injection, and it's no comparison to the other gentleman that I used to get them from. Yes, it's eventually, after a week or so, I started feeling the benefit, and yes, it is starting to be better, and yes, it was better for a while, but it keeps coming back on and off. Where the other gentleman, I had problems for 8 months, so there's something somewhere that we're all open. You know, it's not cut and dried, if you understand what I mean. So yes, we can have, and I do, like John, I take various things which I've told I should take, you know, cod liver oil or this type of thing, and yes, they help. For a lot of people used to help, because I used to play tennis even for, about 10 years ago, and I stopped for that. But anyhow, so I think, like John said, because we've done exercise over the years, we're still healthy and we're enjoying our lives. So thank you very much for your talk, and I hope you just take what I say. Thank you very much.
Thank you very much.
Okay, thank you. So let's go to.
I think I know the gentleman you're referring to. He had problems with immigration, so he had to close down the business, and he was practicing from home, but his neighbours complained, so he had to stop practicing from home, which is a bit of a loss. We do have one last question or statement. Sharing.
As to the breathing exercise or breathing during the exercise, that's the gentleman on the front table. Yes, he said that it's important to note that it's we have to pay more attention to breathing. From my experience, I can say that that's okay. It's very important to breathe correctly, But as you mentioned, first we have to breathe naturally. And if we start paying attention to hold breathe during for when you go down, on when we bend, or when we relax, if we start thinking about it, then we start breathing unnaturally, and it can affect our heartbeat, our that can be dangerous, especially in our age. We are not young, and it can result in problems, in heart problems. So it's better, like you said, just to breathe naturally. Don't pay much attention to breathing if you do exercise. That's my observation, because I noticed that I did a little yoga, and then I heard that during yoga exercise, it's very important to hold the breath for 5, 6, 10. You count and you. But then I noticed it's not so right with me, because I started to feel the heart is not working correctly. You know, so it's better not to do it. You know.
Pranayama, which is one of the Indian yoga disciplines, which is the yoga of the breath. That's a whole art form in itself and a whole study. So, who learnt something today, right? Who learnt something today? If only that when you go to Bangkok Pattaya Hospital, you want to target finding one of these two people, right? It was just a wonderful, and I know Tanya was actually nervous about this morning because we've never done it this way. Round of applause for Tanya to show that it worked, okay?
Thank you very much.
So we have a small, by the way, don't plan to leave too soon, doctors, because you're going to get so many people come up with, oh, I've got an ache here and I want to talk about who's planning to ask the doctors about something they've got after the meeting besides me? Come on, confess. Yeah, there's a few of you going to confess. So, we've got some small tokens of our appreciation for your wonderful educational talks, really plural. Dr. Pratya, thank you so much. And Dr. Nantharath, thank you so much. And, yes, come on. Come in, come up the front, take some photos. But wait, don't anybody move. Nobody move, nobody go anywhere, because Tanya has been so wonderful for this club. We've all learnt so much through the wonderful talks she's organised. We have a special, very special certificate of appreciation for Tanya. Another photo, yeah, got to have a photo with all the three contributors. I didn't really need to be on stage. I think Tanya just had me there to somebody to blame. Thank you, doctors and Tanya. Yes, now we have the lucky draw prize. Have they mixed them up? How many are you drawing? How many are you drawing? 3. 3. Get your lucky draw things down. Get your numbers ready. I mixed them up because we always seem to get the numbers sequential. Oh, it's me. No, it's 72. Who is 72? Hey! You want to come up now to get... Just stay there and show your tickets later, right? Keep that one. You lost your prize. Next number, 68. 68. Okay, just stay there, we'll get you later. And the last one. 60, 2 off me. 60, 60. 60? Yay! Okay, excellent. Was that it? Okay, that was freebies, and then there's 10 discount vouchers. 55. Yeah, mix them up. We're always trying to seem to get. Yeah, what do you got? 49. Just remember your numbers. 64. I do all this mixing up and it's still coming up. 49. 49. 64. No, we had 48 already, didn't we? Did we have 48?
Wait a sec. 49? No, 49, right? No, 49.
Oh, 49's a loser. But 48's a winner.
48? Okay, right there.
And 65. We try to...
65?
We always get them...
Okay, over there. เดินเร็วนิดนึงนะคะไปต่อเลยค่ะ
And 61. Sorry about this. Oh. 61 up the back. Ning won something.
61.
How many we got? 74. 74. 7. Yay! She's a regular.
เท่าไหร่คะเหลือเท่าไหร่คะ
Janet.
คุณแอนโอเค three more
70.
okay 70
58.
58
Ren Alexander. Oh, that's mine.
You?
Yeah.
Really?
Yeah.
Key number
No, it's mine. Oh.
Dr. Len ค่ะให้ได้เลขนะคะพี่เพราะว่าตรงนี้แยกเลขไว้แล้วเดี๋ยวจะไม่ตรงนะคะ you 58
Yeah. It's even got my name on it. Can't believe it.
I thought you were 41.
Good on you.
เพราะว่าตอน
You
นี้
can be my friend.
หมดยังคะ
What?
หมดแล้วค่ะ
What now?
no จะ
Oh. Oh. What is this for? Free rheumatoid arthritis screening. Wow. I'm going to put my number back. Free rheumatoid arthritis screening. 56. 56. Oh, there you go. Well done.
and the last one for today is
So many. It's such a great thing to have Bangkok Pattaya Hospital here.
47
47. There you go. Well done.
Thank you very much.
All right, big round of applause for the team from Bangkok Pattaya Hospital. Don't go, you can leave the stage, but don't go away. These people all want to ask you questions. So, well done. Fantastically educational.